Hi there, Serena. How are you today?
I'm good. How are you?
I'm doing well, thank you. Are you ready to answer a few questions?
I am.
Let's get started. We'll start out with your name
My name is Serena Colsty.
and tell us what you do here at Benefis.
I am one of the home health nurses for community care.
And how long have you been working in healthcare?
I've been in healthcare for about 18 years now.
What's the most unique part of your job?
I would say the most unique part is we are pretty autonomous with our daily schedule. And we get to be in patients' homes seeing things firsthand versus like their appointments with their doctors, they're in their doctor's space. We get to see kind of what they struggle with at home, kind of just right front and center, and kind of get to help them kind of navigate through their needs, just right in their home.
What do you wish patients knew more about when it comes to home health care?
I wish that patients knew more that we really care about them and we really want them to succeed. We do lose sleep over them. We want to solve their problems. And it is really hard sometimes for us to say goodbye at the end of our visits with them.
What's your favorite thing about your job?
Favorite thing about my job would probably be my coworkers are awesome. We all jump in to help each other. If somebody's out sick or has a sick kid at home, we just pick up patients and, the patients don't miss a beat with us. We just fill in and it's everybody that does that. And so I love that about them. I also love, just like I said, seeing the progression of the patients meeting their goals. It just makes us happy to see that we've had a part in that.
What health topics do you think that we should be talking about more?
I wish that we touched a lot more on nutrition with our patients and their chronic health conditions. It seems like we've seen a lot of heart failure, type 2 diabetes, hypertension, that kind of thing. And I feel like a really sound nutrition program could be really beneficial for their health conditions.
What do you like to do in your free time?
In my free time, I love to take my family and go to Disneyland. We're a big Disney family, and or go read on the beach somewhere. I do like to go to the beach.
And then finally, what's your favorite thing about being in Great Falls and working at Benefis?
So I would say my favorite thing about Great Falls is just that it has a small town feel to it. There's a lot of people, a lot of patients that we run into that are not originally from here, don't have family here, but they have really good neighbors and they find a really good support system. So I do like that about just Great Falls in general. And then Benefis just has a lot of opportunities. So I started my career out as a brand new nurse working on the floors of over on rehab. And I did that for about 9 years until my kids kind of became to the age where I needed a little bit more flexibility in my schedule. I needed to be available in the evenings and on the weekends to kind of travel around with them while they were doing their sports. And so then I was able to find this home health setting with really flexibility in the schedule. So I was able to do that at the time when my family needs had changed. And, we don't work nights, we don't work weekends, we don't work holidays, we don't take call anymore. So it's a pretty nice schedule.
Well, we really appreciate you taking the time to speak with us.
Thank you.